Dr. Lasorsa is back with us again today on the program. Glad to have you back in the studio.
Thank you, Dennis. Good morning.
And you've brought a couple of special guests with you today.
I did. I brought a few of my assistants. This is Cece, and this is Alicia.
Glad to have you here.
Nice to meet you. Thank you.
We've talked many times about implants and how they work and so forth. We'll touch on that while we're going along here. But you have a whole new system I see that you've brought with you today, and this must take more than one person to pull it off, right?
Yeah, I think so. Like we've talked about before, we have a lot of different options for implants for patients, whether they need a single tooth replaced, if they need a denture locked down so it doesn't move around, so it's functional, or if they need a whole arch of teeth replaced. So these are the models I've shown you before. We can do a single tooth like shown here. This is a clear model that shows the implant in the bone,
right, and
the tooth you put above it. Or multiple teeth when you're doing a bridge, a few teeth across. Or if they're wearing a denture and they'd like the denture to be locked down and held in place, we have small diameter implants for that. Same with an upper denture. And in some cases we can use the small diameter implants for crowns as well.
So a lot of different options for people.
Right. It all depends on the patient's needs, their bone volume, their bone density, their medical history, their health, and their finances too. We can do a range of something very economical like a denture, or something that's a fixed porcelain bridge all the way around their mouth.
At Citrus Hills Dental, you also know that people love their teeth to be as white as possible, and there's a lot of ways to do that today. And you have brought some different equipment that helps your patients to do that, right?
Before I get into the whitening system, I wanted to talk about what we use to graft bone or to grow bone.
Oh, very good.
This is a centrifuge, which if somebody needs a lot of extractions, or if they don't have enough bone to get a dental implant, or they have a big infection in their tooth and we have to grow the bone back, there's a lot of different options to grow the bone back, but this system uses the patient's own cells, their own platelets and their own growth factors. The way it works is we have the patient come in, we draw some of their blood in these tubes, and it goes into the centrifuge. It spins for a few minutes and it concentrates a layer of all their growth factors, all their platelets. And the benefit of that is that we keep the platelets alive and healthy when we graft it into the area that we need to grow, and it continues to spit out their growth factors for 7 to 14 days. So it's a delayed response, and I'm always amazed at the results we get, how quickly people heal using this system.
High success rate.
Yes, because we're not using anything foreign. We're using the patient's own cells, almost like using their own stem cells to grow back their tissues. We can use it to grow bone. We can use it to grow connective tissue. We can use it to grow gum tissue. Dermatologists are using it to regrow hair. Some plastic surgeons are using it to get rid of wrinkles. So it's pretty exciting. It's a way of tissue regrowth. Because when we want to build somebody's implants, we want a good foundation. We want some good bone to handle the implant so that we can restore the patient's functions.
And new technology makes all these things possible. How old is this kind of technology, really?
It's been out for a couple of years. That's when it came on the market. There was something similar that's called PRP, or platelet-rich plasma. That's been around for a long time. A lot of orthopedics use it also. This is the next level of it. It's called LPRF, leukocyte platelet-rich fibrin. I don't expect anybody to memorize that, but it's just the next generation of it that keeps the cells healthy and alive, so we get a much better response of healing.
Very good. Again, you're always bringing in the new technology, updating things, and all for the benefit of the patient.
Yeah, it makes what we do in surgery a lot easier that we have something like this to regrow their tissue.
Very good. Some of the equipment that you brought in, one piece looked like an iPod. When I first sat down, I goes, "Is that an iPod or what is that?"
This is our Glow White system. This is our whitening system, and this is also a fairly recent product on the market. And I think everybody at one point has tried some kind of whitening for their teeth, whether it's an over-the-counter thing or they come into their dentist and they get their teeth whitened. This is the only system I've ever found that doesn't cause any sensitivity afterwards. Anyone who's had their teeth whitened in the office, I'm sure they'll tell you they couldn't eat anything hot or cold or acidic for weeks. I've tried this product myself, zero sensitivity, and it's very effective. So,
And you ladies hear the results afterward from the patients, right?
Yes,
They're all, very happy and they showing off that bright smile.
that's right. That's right.
This is stuff that they take home with them, or it's just used in the office now?
Both. We have, this is our take-home kit. But basically what we do is usually we have them come into the office. We can do a session at the office which has a little bit of a higher concentrate mixture of our bleaching agent. And what we do is we have about 4 sessions in the chair of 8 minutes each. And we use the bleach. This goes around their neck. It's going to come on.
There it is.
And then we paint it on their teeth. This goes in the mouth, which I can kind of demonstrate here with Alicia.
You get to be our model today. This is the Vanna White of the dental world.
It is.
Here we go.
It's about 8 minutes each session. We do it in the office. And then we get a great result. Usually their shades come up about anywhere from 2 to 3 colors. They go home with a nice bright smile, and then they continue to bleach at home for about a month.
And then after the month, that lasts for a pretty good while, I
It
guess?
sure does. I would say they have to maybe, touch it up maybe once a year.
Wow.
If that.
Well, that's terrific.
Which is common with bleaching.
it has,
Again,
it has to do,
great technology.
it has to do with people's habits too. If they're a
Sure.
heavy coffee drinker like myself, you might have to do it a little more often. Or if they're a smoker, obviously they have to be a little more careful. But really nice results with that, with no sensitivity afterwards.
All right. If you have any questions, we urge you to call Citrus Hills Dental. They'll answer anything that you have to ask them about implants, about the new technologies available, about whitening, and just good dental care. And that's the basics. That's the basics. I want to thank you all for joining us on the show today. And
Thank you.
we'll have you back again soon.
Sure.
Talk a little bit more dentistry. All right, stay with us because there's more to come on Citrus Today right after this.